Welcome back. Joining me now is Kimberly Simpson from Precision Therapeutic Massage. And one of the things I know that you specialize in there, and that's, I guess, the precision part, is TMJ.
Yes.
Right? Explain TMJ a little bit, first of all, if you can.
Well, TMJ is actually your jaw. The part that we deal with is the dysfunction of that.
Right.
So it's TMJ disorder, basically.
That's what you have, that popping and cracking with your jaw and things?
Right, and also known as lockjaw. So when you can't open your mouth as well, it's hard to chew things.
Yeah. Well, so what do you do as far as helping people? Because, I mean, it's not as rare as one might think when you're talking about TMJ. Yeah.
We see a lot of people with this issue. A lot of people get headaches and don't realize it's from their jaws, sensitive teeth, and they don't realize it's just the muscles in their mouth. So what I do is I actually put my gloves on and I get inside there and work the muscles from the inside of your mouth instead of just the outside. All
right, now is this something also that, you know, there are people who when they sleep, they're clenchers?
Absolutely.
And they keep their jaws clenched like that. Is this along that sort of line too?
Yeah, a lot of people when they're stressed tend to clench their jaws even during the day, but at night is the more common. So they wake up and they've got a headache or their face just hurts.
Okay, all right. So they may not even know they have TMJ, but this can kind of help ease what's going on in there.
Yes.
You want to show us how this is all done?
I would love to.
All right, and I know we have our lovely and talented model here.
I
told him I could have laid down and had this done too, but all right.
That's awesome. Okay, so the first thing that I'm going to do is just have you open your mouth and promise not to bite me. And so I'm just going to stick my finger in there and have you relax. And then what I'm aiming for are the masseter and the lateral and medial pterygoids, which are your jaw muscles.
Yeah.
So I just get in there.
I figured that part, really.
And then when I see the tears stream down his face, I know I've got it.
Okay, all right. Good job.
He's blinking a little bit. Not crying, though, so we're okay. So I get in there and find those spots that are causing the jaw to not open, and I just loosen them up. Just the same way you would any muscle. I just happen to be doing it from the inside of your mouth instead of the outside.
This is this is kind of a kneading, or are you working the muscle itself?
Certain muscles you're just going to give it a little tap, and so you don't overwork it, and some of them it's going to be more of like kneading would be an okay word.
Okay. Yeah, I have to speak from the layman's point of view.
Yes,
I wouldn't.
That would work.
Okay. How long does this? Is this a one-time thing? Is this a regimen that you tend to go through?
It depends. If your jaws are locked up because you just spent several hours in a dentist chair, that's usually going to be maybe one treatment because it only happened one time. But if you're a jaw clencher and you wake up in the morning with a headache and your jaws are always tense, it's going to be something you'll want to do maybe weekly or monthly even to keep those loosened up.
You showed us the one procedure. Are there others that you use to help loosen people's jaws up, things like that?
Yes, there are some on the outside. So I'll go ahead and take this glove off.
Okay.
Give myself
was that all right? That was kind of different, wasn't it?
Yeah.
Yeah, okay.
So now I'm not going to put lotion on your face, but we'll pretend. So the neck is also a big component. So your jaws and your neck play together. So I'm always going to loosen up the neck muscles just by getting in here and feeling in between each vertebrae. Loosen those up really well. And then I'm just going to hold and then take my thumbs and get down into the masseter there. And I'm going to have him just relax. And as I push down, let your jaw fall open. So it's sometimes really hard for people to relax and let you
This is
do the
well,
work.
yes, when you're working on it's a little bit different, but you're right. When you talk about the tension, it tends to come through the neck and then up through your face this way.
And sometimes you'll get a headache or an eye ache right behind your eye, and that's totally from your jaw muscles too.
Oh, okay.
So,
all right. So what do people? I mean, how much time do you if you go in for a treatment, how much time are you expected? Should you kind of set aside to do something like this?
It just depends on the person. The first time that I see you, I'm going to probably want at least 30 minutes to an hour. But if the follow-up appointments, if you're doing pretty well, those can be 15, 20 minutes. So you can get in and out.
How do people find you?
We are in the Glenstone Square Shopping Center. It is located directly behind Coyote's Adobe Cafe. It is 1740 South Glenstone, Suite M as in Mary.
All right, Kimberly, thank you so much. Hope you enjoyed that. All right. We'll be back with more Ozarks Live after the break.